Hello, my name is Taylor, and today this talk will revolve around the impact that postpartum depression can have on maternal mental health and the importance of early recognition and support to promote positive outcomes for both mother and child. Postpartum depression is specifically defined as depression that happens after childbirth. However, it is so much more than that. Postpartum effects can begin before, during, right after birth, and months, if not up to a year later. Advanced health practitioners, both in women's health fields and beyond, should be educated on the importance of postpartum depression to reduce complications if left untreated and unidentified in a timely manner. Early identification is essential in ensuring proper resources and support can be provided to these mothers and their families. As advanced practitioners, as well as family and friends of pregnant women, there are some physical, mental, and emotional signs that we can look out for. Some common physical signs include reports of frequent headaches, increasing fatigue, muscle aches, and restlessness without proper sleep, which could eventually turn into insomnia. Mental and emotional signs to identify include frequent mood swings, forgetfulness, indecisiveness. Some internal feelings of shame, guilt, and worthlessness are also all signs of postpartum depression. Unfortunately, though, these signs are much more difficult and challenging to identify because they are not always thoroughly communicated and expressed. This is when that communication between family and health provider, as well as screenings that we'll discuss in future slides, come into play to determine how mothers are feeling, but they may not always be saying. Many conditions include specific individuals who are at risk for illnesses like genetic predisposition, environmental influences, but in regards to postpartum depression, all women are unfortunately at risk. Those with existing depression and anxiety diagnoses, they do have a greater risk of developing worsening symptoms postnatal, so therefore they should be monitored more closely according specifically to the International Journal of Women's Health. Unfortunately, health disparities exist in nearly every situation due to each individual patient being their own person and experiencing unique and oftentimes negative factors. Postpartum depression is no different and still contains health disparities, many of which are modifiable with the proper support and resources. Lack of knowledge about postpartum depression can be rectified with appropriate time and attention to this condition from advanced practitioners and family members. Lack of resources can be improved by pointing patients to proper assistive interdisciplinary teams, such as social work, who can work with the patients in setting up routine health visits. The stigma surrounding PPD is difficult due to the pre-existing notions that many individuals, even mothers, have regarding this condition. Patients with positive input and supportive groups, if experiencing postpartum, allows communication so that they don't feel alone and they don't have these feelings of worthlessness and shame. This also includes determining if moms do have a support group at home with family and friends, and if not, resourced support groups can be of assistance as well. Racial inequity is something that as current and future practitioners, we all need to make consistent strides towards eliminating any of our bias and pre-existing notions that we may have. Every single patient deserves 100% from their healthcare provider, and building that solid, trusting foundation and rapport with these patients provides and allows the opportunity for better outcomes and success in the long run. For patients experiencing domestic violence, it's important for healthcare providers to look out for warning signs and create this safe space for patients to be honest and open. This allows the chance to offer the help and support that they and their families may need, free of judgment and pressure. As healthcare providers, it is important to recognize that all of these health inequities play a contributing role in the development of postpartum depression and/or worsen an existing postpartum depression diagnosis. Recognition and positive intervention can lead to the improvement of both the mother's mental health as well as benefit the child's future development and bonding. Giving both mother and their child this chance to create a positive relationship is the true goal of any of the existing interventions. In the next slide, we'll discuss some of the most commonly used interventions in postpartum depression assistance. Per the International Journal of Mental Health, interventions for postpartum depression are constantly evolving into a tailored treatment rather than this one-size-fits-all idea. This is because, as we stated previously, all patients are different and they all offer their own backgrounds and experiences. Because of this, their care should reflect them personally and not globally. Some web-based therapies are being offered in order to provide an alternative to in-person appointments if transportation or expenses are a factor affecting them getting help. Support groups also allow other mothers experiencing this condition to connect and share stories in a therapeutic capacity. Although good for therapeutic purposes, these groups also offer mothers ideas and practices that they can take with them to improve their own personal conditions at home that they may not have found on their own. Routine and follow-up screenings are probably some of the most important factors and interventions in preventing complications from postpartum depression. Although postpartum does begin after childbirth, signs and risk factors can exist prior. These screenings allow providers to determine a mother's risk in developing postpartum depression and can intervene and offer referrals and resources prior to negative impacts. These follow-up screenings are also essential in patients with postpartum and even in those not diagnosed with this condition because of the risk of potential development within the first year postnatal. Our role as current and future providers is ultimately to provide the best possible care we can for our patients. In order to achieve this, we cannot always simply treat patients symptomatically, but we also need to treat them proactively as well. Our patients rely on us to keep them safe and healthy, and to do so, open communication, honesty, and feedback from provider and patient is necessary. Although many times patients need to provide just as much work to ensure their health outside of our offices, in conditions such as these, like postpartum depression, this becomes much more difficult. Therefore, engaging a patient's family members and interdisciplinary collaboration to set mothers and their families up for this success is so crucial in this condition. Whether women's health is a provider's specialty or not, I believe that all providers can agree that pregnancy should be an exciting, rewarding time, and we should all do everything we can to ensure mothers achieve this reality rather than the alternative.